Did you file your tax return? Today's the last day to file taxes for the year 22, and if you haven't filed them yet, chances are, and I hope, that you have filed an extension for those taxes. Either way, even more important, if you have marketplace health insurance, right? Here's why. For the year 2022, when you applied for insurance, which likely happened at the end of 2021, you were asked to estimate how much money you thought you were going to make as a household for the upcoming year. Now, fast forward, you've received a form called the 1095. That form describes exactly to the penny how much money was provided to you in tax credits for the year 22. When your accountant files your tax return, he is going to match that along with all your other documents on your 1040 form. That 1040 form is going to show what you actually made for the year 22. For example, if you estimated that for the year 22, you made $40,000, in reality, when you file your tax return, you made $60,000, that means the government gave you more tax credits towards your health insurance than you qualified for. How much? Whatever that difference is between somebody that makes $40,000 and somebody that makes $60,000. If that's an extra $2,000 or $3,000 that was given to you to cover your health insurance, you are going to pay that back. You're going to have a tax bill and they're going to collect it either from a refund that's due or you're going to have a bill to the IRS. This is why it's so important that if you are doing marketplace health insurance, that you do these three things. Number one, always estimate based on last year's income. Unless you're going to get a big raise or you anticipate to make more money, it's best to just use the same numbers that you had the year before. Number two, once you've enrolled and done your application, you should go on to healthcare.gov and confirm that the income that is on that application is in fact how much should be on there. And number three, make sure that you're working with an agent that has your best interest. So far this week and last week, I've spoken to several families, one that owed $2,800, one that owed $4,000, and I even talked to one that owed $7,800 in tax payments because the agent that they used when they did their 2022 health insurance put down on their application that they made a third of what they actually made. So when they filed their tax return and they received that 1095, it ends up showing that they received $7,800 more than they should have. Yes, throughout the year, they paid a very, very small amount for their health insurance premiums. But now they have to pay back the IRS $7,800. Don't get stuck in a situation like that. Make sure that you're estimated properly. If you're self-employed or commission-based and your income fluctuates, then you need to update that income several times a year. You do not want to end up owing thousands and thousands of dollars, and don't listen to all the hype and all the stuff that's out there that you can put less than what you make and it's not going to affect you. Stop listening to that. That is not true. These are forms that are confirmed with the IRS, with your accountant, and correlate directly to your tax return. I hope this helps. If it does, like it, share it, and subscribe to the YouTube channel.